Hi, my name is Nobie Mitchell. I am a Georgia SHIP counselor volunteer. I will be speaking with you regarding preventative services. Part 3, Cancer and Cardiovascular Services. Medicare has several parts: Part A, Part B, Part C, and Part D. And when you're in need of specific services, it can be lots to learn and consider. Medicare Part B, medical insurance, covers many preventive health care services to prevent illness like the flu or detect any illness at an early stage that are completely free for you. What cardiovascular services does Part B cover? Cardiovascular disease screening. Medicare Part B covers cardiovascular screening blood tests once every 5 years to help detect conditions that may lead to a heart attack or stroke. Cardiovascular behavior therapy. Medicare Part B covers a cardiovascular behavior therapy visit once every year with your primary care doctor or other primary care provider in a primary care setting like a doctor's office to lower your risk for cardiovascular disease. How does Part B assist with prevention of cancer? Cervical and vaginal cancer screening. Medicare Part B covers Pap tests and pelvic exams to check for cervical and vaginal cancers. As part of the pelvic exam, Medicare covers a clinical breast exam to check for breast cancer. Medicare covers these screening tests once every 24 months in most cases. If you're at high risk for cervical or vaginal cancer, or if you're of childbearing age and had an abnormal Pap test in the last 36 months, Medicare covers these screenings tests once every 12 months. Part B also covers human papillomavirus tests, HPV, as part of a pap smear test once every 5 years if you're aged 30 to 65 without HPV symptoms. Mammograms. To prevent breast cancer, Medicare Part B covers a baseline mammogram once in your lifetime if you're a woman age 35 to 39. Screening mammograms once every 12 months if you're a woman age 40 or older. Diagnostic mammograms more frequently than once a year if medically necessary. Prostate cancer screenings. Medicare Part B covers digital rectal exams and prostate specific antigen PSA blood tests once every 12 months for men over 50, starting the day after your 50th birthday. Note, after you meet the Part B deductible, you can pay 20% of the Medicare approved amount for a yearly rectal exam and your doctor services related to the exam. In a hospital outpatient setting, you also pay a separate hospital visit copay. Lung cancer screenings. Medicare Part B covers lung cancer screenings with low-dose computed tomography once each year if you meet all the updated conditions. Colorectal cancer screenings. Medicare Part B covers the following necessary screenings to prevent colorectal cancer. Colorectal cancer blood-based biomarker screenings. Medicare Part B covers a blood-based biomarker lab test to screen for colorectal cancer. Multi-target stool DNA tests. Medicare covers a at-home multi-target stool DNA test once every 3 years if you meet all conditions. Bereavement, enemas. Medicare Part B covers this test once every 48 months. If you're age 45 or older, and when your doctor uses it instead of a flexible sigmoidoscopic or colonoscopy. If you're at high risk for colorectal cancer and you are age 45 or older, Medicare covers this test once every 24 months. You pay 20% of the Medicare approved amount for your doctor's services. In a hospital outpatient setting, you also pay the hospital copayment. Colonoscopies. Medicare covers screening colonoscopies every 24 months if you're at high risk for colorectal cancer. If you're at high risk, Medicare covers the test once every 124 months or 48 months for a previous flexible sigmoidoscopic. There's no minimum age requirement. If you initially have a non-invasive stool-based screening test, fecal occult blood test, or multi-target stool DNA test, and receive a positive result, Medicare also covers a follow-up colonoscopy as a screening test. Note: if your doctor finds and removes a polyp or other tissue during a colonoscopy, you pay 15% for your doctor services in a hospital outpatient setting or ambulatory surgical center. You also pay the facility a 15% coinsurance amount. Fecal occult blood tests. Medicare covers screening fecal occult blood tests if you get a referral from your doctor, physical assistant, nurse practitioner, or clinical nurse specialist. If you're 45 or older, Medicare covers this lab test once every 12 months. If you're under 45, Medicare doesn't cover this test. Flexible sigmoidoscopical. Medicare covers a flexible sigmoidoscopic screening once every 48 months for most people age 45 or older. If you aren't at high risk, Medicare covers this test 124 months after a preceding screening colonoscopy.